There's a man named Walter who lives 3 houses down from a small clinic in a quiet neighborhood. And every Tuesday morning, like clockwork, he walks in for his blood pressure check. He's 74. He's sharp as anything. And one Tuesday, he sat down and said something that stopped the nurse in her tracks. He said, "I've been doing everything right. I cut out sugar. I cut out bread. I barely eat rice anymore. And my numbers are still all over the place after dinner. I don't understand it." And here's the twist nobody expected. Walter wasn't eating the wrong things. He was doing almost everything the diet advice told him to do. The problem wasn't on his plate at all. It was in what happened in the 15 minutes after he put his fork down. And once he changed that one thing, his after-meal numbers dropped faster than anything his diet changes alone had ever done. So here's the question I want you to sit with for the next few minutes. What if the fastest way to bring down a blood sugar spike has almost nothing to do with what you eat, and almost everything to do with what your body does in the half hour right after? Hey, welcome back. I'm Dr. Everett Cole, and this is Health Decoded, the show where we take the confusing, contradictory advice out there about your body and break it down into something simple, something real, something you can actually use today. No fear tactics, no miracle powders, just the science, explained the way it should have been explained to you the first time. And today we're talking about the single fastest lever you have to bring down a blood sugar spike, faster than any food swap, faster than any supplement, faster than almost anything else available to you without a prescription. Let's get into it. The myth we all believed for years, the advice around blood sugar has centered almost entirely on food. Eat less sugar, eat less white bread, watch your portions, count your carbs. And look, all of that matters. I'm not here to tell you food doesn't matter, because it absolutely does. But here's what almost nobody tells you. Food only sets up the spike. It doesn't determine how fast that spike gets cleared out of your bloodstream. That part is controlled by something else entirely, something most people never activate, even when they're doing everything right with their diet. This is exactly where Walter got stuck. He'd done the hard work of changing his plate, but he was sitting down right after dinner watching television and letting that glucose sit in his bloodstream with nowhere fast to go. And that's the part almost every article, every meal plan, every diabetic-friendly cookbook completely skips over. So if food only sets the stage, what actually clears the sugar out fast? To understand that, we need to take a quick trip into what's actually happening inside your body after you eat. When you eat something with carbohydrates, your digestive system breaks it down into glucose, and that glucose gets released into your bloodstream. Think of your bloodstream like a busy highway, and glucose molecules are like cars flooding onto that highway all at once after a meal. Too many cars, too fast, and you get a traffic jam. That traffic jam is your blood sugar spike. Now your body has a cleanup crew for this. It's called insulin, and its job is to act like a set of doors on the side of the highway, opening up exits so those glucose cars can leave the bloodstream and get absorbed into your cells, where they're either used for energy or stored for later. Here's the part that changes everything. Insulin doesn't work alone. It needs receiving stations to actually pull that glucose out of the blood, and your muscles are by far the biggest receiving stations you have. In fact, your skeletal muscles are responsible for soaking up the majority of the glucose that leaves your bloodstream after a typical meal. Not your liver, not your fat cells, your muscles. But here's the catch. Those receiving stations, little transport doors on the surface of your muscle cells, work in two different modes. Mode 1 is passive. It waits around for insulin to knock on the door. That's slow, and if your body isn't responding to insulin as efficiently as it used to, which happens gradually as we age or as our metabolic health shifts, that door can be slow to open. Mode 2 is active, and this is the part almost nobody talks about. When a muscle contracts, when it actually works, even a small amount, it opens up a completely separate doorway for glucose to rush in, one that doesn't even need insulin to function. It's like adding an entirely new exit ramp to that traffic-jammed highway, one that opens up the second your muscles start moving. This is why movement after eating is so much faster at clearing a glucose spike than almost anything you could change about the meal itself. You're not waiting for your body's insulin response to slowly catch up. You're forcing open a second door immediately. The turning point. Now, if you've followed along this far, this next part is where it actually gets useful, because understanding the mechanism is one thing, but knowing exactly how to use it, how much, how long, and when, is what actually moves your numbers. So before we go further, if this is making things click for you, do me a favor and hit that like button, and if you're new here, subscribe, because we go deep into topics like this every single week, the kind of explanations you don't usually get in a 10-minute doctor's visit. Drop a comment below and tell me how long you've been trying to manage your blood sugar. I read every single one, and it genuinely shapes what we cover next. Alright, let's get into exactly how to use this. The fastest levers you actually have. Step 1. Move within the first 15 minutes, not after an hour. Most advice tells you to go for a walk after dinner, without ever specifying when. And that vague instruction is where most people lose all the benefit before they even start. Here's why timing matters so much more than people realize. Your glucose doesn't wait politely for you to finish your show, load the dishwasher, and settle onto the couch before it starts climbing. It starts rising almost immediately after your first bite, and depending on what you ate, it typically peaks somewhere between 45 minutes and 90 minutes later. That window, those first 15 to 20 minutes after your last bite, is the on-ramp period, the moment where glucose is flooding into your bloodstream fastest, and your muscles have the biggest opportunity to intercept it before it accumulates into a full spike. Think of it this way. If you wait an hour to go for your walk, you're not preventing the spike anymore. You're chasing it after it's already happened. You're mopping up a mess instead of stopping it from forming in the first place. That's still useful, don't get me wrong. A late walk is better than no walk. But it's playing defense instead of offense. Moving within those first 15 minutes is playing offense. You're meeting the glucose at the door and redirecting it into your muscles before it ever gets the chance to pile up in your bloodstream and trigger that steep, uncomfortable spike. And here's the good news. This doesn't require anything dramatic. It doesn't mean lacing up your shoes for a formal walk the second your fork touches the plate. It can be as simple as standing up right after your last bite and doing light movement in the kitchen for 5 minutes, wiping down the counter, putting away leftovers, doing a few slow calf raises while you wait for the kettle to boil. The goal isn't intensity in that first window. The goal is simply getting your muscles contracting again before the glucose has a chance to build momentum. Even a modest 5 minutes here can blunt the height of the entire spike that follows, which is something no amount of careful meal planning can do on its own, because meal planning only controls what goes in. This step controls what happens to it once it's already there. Step 2. Prioritize your legs, not your arms. Here's something a lot of people get wrong when they think about post-meal movement, and it's an easy mistake to make, because we tend to think of exercise as one uniform thing. It isn't. Not all muscle activation is equal, not even close, and which muscles you activate matters just as much as whether you move at all. Your leg muscles, particularly the large muscles in your thighs, your glutes, and your calves, are some of the biggest glucose consumers in your entire body. This comes down to simple size and demand. These are the largest muscle groups you have, and even during light activity they require a steady supply of fuel to keep contracting, which means they're constantly pulling glucose out of your bloodstream to meet that demand. Compare that to your arms, which are considerably smaller and require far less fuel to do the same amount of work. You could do arm circles for 10 straight minutes and barely put a dent in your blood sugar, simply because there isn't enough muscle mass involved to create meaningful demand. This is part of why something as simple as a short walk, or even just standing at the counter and shifting your weight from foot to foot while you clean up, tends to outperform upper body movement for lowering a spike quickly. Your legs are doing quiet, constant work with every step, every shift, every subtle contraction, and that work translates directly into glucose being pulled out of your bloodstream and into your muscle tissue. So if you're short on time, and let's be honest, most of us are, don't waste those precious few minutes on arm circles or light stretching that mostly involves your upper body. Put the effort where the payoff is biggest. A few sets of slow calf raises at the sink, a handful of shallow squats while you wait for coffee to brew, or a short walk around the block will do far more to bring your numbers down than almost any upper body movement you could choose instead. Step 3. Use short bursts instead of one long session. This is probably the most counterintuitive piece of the whole puzzle, because most of us were raised on the idea that exercise only counts if it's a proper, dedicated block of time, 30 minutes on a treadmill, a full workout class, something that shows up clearly on a calendar. But when it comes to blunting a glucose spike, that mental model actually works against you. There's a reason athletes and researchers studying metabolic health have both landed on a similar conclusion here. Several short bursts of muscle activation spread across a couple of hours after eating tend to outperform one long continuous session done later. Remember those glucose doorways we talked about, the ones that open in your muscle cells the moment they contract? Those doorways don't stay open indefinitely. They open, they do their work for a while, and then if the muscle goes back to being still, they gradually start to close again. If you do one long walk and then sit still for the rest of the afternoon, you get a strong window of glucose clearance during the walk, but then that window shrinks back down once you're back on the couch, and your muscles go quiet again, while glucose from later snacks or a second meal keeps arriving. Short, repeated bursts solve this differently. A few minutes of squats, calf raises, or brisk stepping every 30 to 45 minutes keeps propping that door back open again and again throughout the day, rather than opening it once for a long stretch and then leaving it shut for hours. It's less like unlocking a door for one long visit and more like knocking on that door repeatedly so it never has the chance to fully seal shut. In practice, this looks something like this. Instead of committing to one 30-minute walk after dinner, You might do 5 minutes of movement right after eating, another few minutes 45 minutes later, and another short burst an hour after that. You don't need a gym for this, and you don't need special clothes or equipment. You need a timer on your phone, and a willingness to stand up every so often, even if it's just for the length of one song. Small, repeated interruptions to sitting still turn out to be one of the most efficient ways to keep your glucose curve smooth and steady, instead of spiking sharply and lingering high for hours. Step 4. Don't skip the 15-minute mark just because you feel fine. This is the one that trips people up the most, and honestly, it's the one I have to remind even the most disciplined people about, because it goes against how we naturally judge whether something is necessary. Most of us wait for a signal before we act. If we feel pain, we treat it. If we feel tired, we rest. So if we don't feel anything unusual after a meal, our instinct is to assume everything is fine internally too. But glucose spikes are frequently silent, especially in the earlier stages of metabolic changes. You can feel completely normal, energetic, clear-headed, no crash, no fog, and still have a significant rise happening inside your bloodstream that you simply cannot feel. This is one of the trickier aspects of blood sugar regulation. Unlike a headache or a stomachache, a glucose spike doesn't always announce itself. It happens quietly, meal after meal, and the body absorbs the impact internally long before any outward symptom shows up. Over months and years, though, that quiet, repeated pattern adds up. Repeated spikes contribute to low-grade inflammation throughout the body. They place ongoing strain on the very systems responsible for managing your blood sugar, and they're part of the slow wear and tear that eventually shows up as the more serious metabolic issues people associate with getting older. Fatigue that doesn't have an obvious cause, stubborn weight around the midsection, or numbers that gradually creep upward year after year during routine checkups. This is exactly why building the post-meal movement habit, regardless of how you feel in the moment, is what actually protects you long-term. If you only move on the days you feel sluggish or notice a crash, you're only addressing a fraction of the spikes actually happening. The habit has to become automatic, something you do after eating simply because you ate, not because you're waiting for a signal that by the time it shows up may mean the pattern has already been repeating itself for quite a while. Step 5. Hydrate before you move, not after. This one tends to surprise people because water doesn't feel like it belongs in the same conversation as squats and short walks. But it matters more than most people would ever guess, and it works quietly in the background of everything else we've talked about so far. Here's the mechanism. Your blood isn't just glucose floating around. It's glucose dissolved in a certain volume of fluid. When you're even mildly dehydrated, that volume of fluid shrinks, and the same amount of glucose ends up more concentrated within a smaller amount of blood. The glucose itself hasn't necessarily increased, but the reading looks higher simply because there's less fluid to dilute it in. On top of that, dehydration affects your circulation, the very delivery system responsible for carrying that glucose from your bloodstream over to your muscles where it can actually be used and cleared. When circulation isn't running efficiently, glucose has a harder time reaching those newly opened muscle doorways we talked about earlier, even if your muscles are actively contracting and ready to receive it. So a glass of water before your post-meal movement isn't just a nice-to-have alongside digestion, which it does help with too. It actually supports the transport system underneath everything else on this list. You could do everything right, move within the first 15 minutes, activate your legs, break it into short bursts throughout the afternoon, and still get a smaller benefit than you should if your circulation is sluggish from being underhydrated. Pairing a glass of water with your movement isn't the flashiest step on this list, but it's the one that quietly makes every other step work better than it would on its own. A real example, I want to tell you about a small experiment I ran with a handful of patients a while back. Nothing formal, just something to see the pattern with my own eyes. 2 people ate the exact same lunch on 2 separate days. On the first day, they sat down immediately afterward and stayed seated for 2 hours. On the second day, they stood up within 10 minutes and did nothing more than light stepping in place for about 4 minutes, 3 separate times over the next hour and a half. The difference on the glucose monitor wasn't subtle. On the sitting day, the spike climbed steadily and stayed elevated for a long stretch before slowly coming back down. On the movement day, the peak was noticeably lower, and it came back down to baseline meaningfully faster. Same food, same portion, same person. The only variable was those few minutes of muscle activation spread across the afternoon. That's the kind of difference that convinced me this deserved its own conversation, separate from the usual just eat less carbs advice. Now, I want to be responsible here, because blood sugar isn't something to take lightly. If you're already living with diabetes, if you're on medication that affects your glucose or your insulin levels, or if you notice symptoms like sudden extreme thirst, blurred vision, confusion, or unexplained weight loss, please don't treat anything in this video as a replacement for working with your doctor. Movement is an incredibly powerful tool, but it works alongside medical care, not instead of it. If your numbers are consistently high or unpredictable, That's a conversation to have with a professional who can look at your full picture, not just one piece of it. For the everyday, gradual after-meal spike that so many of us deal with quietly, the kind that leaves you feeling tired and foggy an hour after lunch, this is one of the simplest, fastest tools you have, and it costs you nothing. I think about Walter a lot, because his story is so ordinary, and that's exactly why it matters. He wasn't ignoring his health. He was trying, genuinely trying, and doing a lot of the things he'd been told to do. He just never knew about the part that happens after the fork goes down. Once he started standing up for a few minutes after each meal, pacing around his kitchen, doing a few slow calf raises while he waited for the kettle to boil, his after-meal numbers started coming down within about 2 weeks. Not because he changed what was on his plate again, because he changed what his body did in the 15 minutes that followed. If Walter had known this years earlier, I think a lot of frustrating Tuesday mornings would have looked different. And that's really what I want for you. Not another restriction. Not another food to feel guilty about. Just one small, doable shift that works with your body instead of against it. So here's what I want you to do. After your very next meal, don't reach for your phone and sit down. Stand up, walk to the sink, do a few calf raises while you rinse a plate. Give your muscles those few minutes to do the job they were built for. It costs you nothing, and it might be the fastest change you make all year. If this helped you understand something you've been struggling with, hit subscribe, share it with someone who's been fighting their numbers the hard way, and I'll see you in the next one, where we're going to talk about the one habit at breakfast that quietly undoes everything you did the night before. Thank you for watching, and take good care of yourself.